All right. All right. So tell us your name.
My name is Tammy Thomas.
All right, Miss Thomas. Now, to the people watching this, many times we play these videos at our seminars. What did you originally? You came in to us here at Columbus Physical Medicine Center. What was wrong? What was hurting?
I originally came to Columbus Physical Medicine for my neuropathy. I had severe neuropathy in my hands and my feet.
Right. And how was it affecting your life? How did it feel, and what was it stopping you from doing?
Neuropathy stops you from doing several things. With my hands, it made me very clumsy. I couldn't feel what I was holding. If I tried to pick something up, I couldn't tell how tightly I was holding it. I would drop things often. It's very irritating to be so clumsy. With my feet and my hands, cold is extremely painful. The bones hurt when they're that cold.
You mentioned too the way you were walking. It felt like you were encased in cement. Could you talk about that?
Sure. When I first got neuropathy, I walked like a toddler because my feet felt like they were encased in cement, and my steps were heavy, like a new baby walking would be when. So I walked like a baby, and eventually I got used to the fact that my feet weren't as heavy as I thought they were, and I could walk normal. But there are times when I don't feel things like when floors change from one floor to the other, the little transition part in the doorway or stuff like that. I would lose my balance because I couldn't tell that it was there. When normally when you feel your feet, you know that the floor levels change, and I couldn't tell the difference between floor levels.
That's dangerous. I mean, you could fall.
Yeah,
easily.
and I've fallen several times with trying to transition from a curb to a sidewalk, or the sidewalk down to the road, and then you have the cement part, and then the parking lot, the paved parking lot. Things like that will just throw you off.
Right.
And
we have treated several patients with neuropathy that have taken some pretty dangerous falls. Now, as far as the treatment goes, how we have a plan to help this neuropathy. What's been your experience with that? Good and bad. I want a real honest appraisal of what you've done so far.
So far, when I first started coming, I couldn't feel, like I said, I couldn't feel my feet. I couldn't feel my hands. Now I feel my hands. There's a slight tingling in my fingertips, which I can deal with. I do know when I'm holding something in my hand. It's only rare now that I drop stuff because I can't tell how well I'm holding it.
Right.
Or I can't tell that it's on my fingertips.
Right.
With my feet don't hurt like they used to. Cold doesn't seem to bother them as much.
Right. How's your walking?
My walking has improved greatly. I still can't walk for long distances of time because my feet get really sore.
Right.
But just walking across the floor, I can tell sometimes when my foot touches something, and I can instinctively move, where before when I would walk across the floor and I would step on something, I wouldn't know it was there until I get a sharp jab. It's like stepping on a nail or a sharp rock feeling in my feet, and that would be so painful.
Right.
Now I know when I step on something, I can almost identify what it is I stepped on, and it doesn't hurt as much. My feet no longer feel encased in cement blocks, but they feel more normal. I feel more sensation on the bottom of my feet. Right now I'm still having a bit of a problem with the top of my feet.
Right.
It just feels like the cement blocks are sitting on top of my feet. The cold still bothers my toes a bit, but not my whole foot.
Not your whole foot. So you're definitely seeing improvement, would you say?
Yes,
in the
I'm
right
definitely
direction?
seeing improvement. I'm more active now.
Good.
Where I used to work out at the gym, and I was doing high intensity workout, and in 18 months I haven't been able to do that. I'd get on a treadmill, it would throw me off. I'd pick up weights and I couldn't tell if I was holding them or not, and I was dangerous with them, so I didn't go to the gym anymore. I've gained like 30 pounds, So now I just started back on a new workout. It's Pilates. I've started out on a lower workout now, and I did it for the first time yesterday. I feel like I could feel the bars and the mats on the floor.
Wonderful.
But I think the exercise is going to help also.
Absolutely.
I've been given a tinge unit, the BioFreeze. I've done the magnetic chair. I've done the anodyne, Hakamed.
Right.
We've done this pulsing thing. It's like a massager.
Yeah, the pulse ultrasound. Right.
And
what do you think? Do most of these therapies, are they painful to you? Are they tolerable?
They are not painful at all. I've done also the bicycle with the oxygen flow.
Exercise with oxygen, right?
All of these things have improved. Now, at the beginning, I did go to do acupuncture, which I think did nothing at all for me.
Right.
I also tried massages.
Mm-hmm.
I don't think they do anything. I still do a massage once a month on my feet and hands.
That's good.
And it takes a lot of time you notice differences, but then you can't come every single day.
Yeah.
And so week by week, you notice gradual changes. Right.
So people out there should know that it's not going to be, for most people, it's not going to be an overnight change.
No, it's not an overnight change. It's not a week or month change. It's going to take a few months to actually tell the difference. But I am noticing a big improvement in my ability to walk, and my ability to feel my hands and feet. There are some days, and I have really good days where I feel almost normal. Right. I still have days where I feel like I'm right back at the beginning. My hands and feet will buzz and burn really bad, but then...
And actually the buzzing and burning, we tell people, we tell our patients that's the nerves healing. And many times you'll have that. But it's better than being totally numb, you know.
Right.
And that will go away. That's so that's wonderful. So, overall, if 10 were, when you're at your worst, and if 0 were not having any numbness and tingling, perfect sensation, where would you say you're at? Would you say you're...
When I first started here, I would say they say on a up to 10 basis, I would have said a 10 plus.
Right.
And now when I come in, I say I'm at a 2, simply because of my toes.
Just your toes.
And the top of my feet.
And we're going to keep working on that. Well, thank you so much. And this is a good in-depth kind of view on what happens during our neuropathy treatment. It is a long haul, but that's about the only thing we know that gets you well. So thank you so much.
You're welcome.
And keep getting well. Thanks.